want to give you as much time as we promised you. And so without further ado, you're out there at Washington State, and the thing we're interested in hearing about is public health policy that you found to be based on modeling. And we look forward to your sharing that.
Okay, thank you very much.
Thank you for sharing.
Yeah. So thank you for coming to this session. So what I'm going to talk about is, when we discuss differential equation in a class, most of the time, we give an equation and we kind of show them how to solve the equation in a mechanistic way. But sometimes, I feel like that we need to excite the students about why we want to learn differential equation. So one way to do that is to relate the differential equation to a mathematical model that is realistic. So one of the things I have done in the past is to look at the spread of infectious diseases. So, in the early days, I will talk about spread of flu, then Ebola came along, then I talk about Ebola. Then, in the last few years, we've been talking about COVID-19. So whenever you talk about an infectious disease, sometimes, when you talk about flu, for example, flu has been around for a while. We have vaccinations and stuff like that. But when COVID-19 came, it's a new virus. So there were no vaccinations. So when you talk about the model, then we think about, how do we determine the rate of infection and various things like that. How do you decide who should be isolated and what is the social distancing and those kind of concepts. So let me start showing some slides. So typically, the young people nowadays, they are very interested to know about chemical pollution. And then in the case of COVID-19, how do the infectious diseases spread? So typically a simple mathematical model for the spread of infectious disease is the SIR model, where you look at the community, a small community, and divide them into three compartments. One compartment is the susceptible, the other compartment is the infected, and the third compartment is the removed. I use the word removed instead of recovered because, like in the case of COVID-19, there are people who recover, there are people who unfortunately pass away, and there are people who get isolated. So all these three categories of people come into the removed group. So when we talk about this model, I talk to the students about, what do we mean by epidemic? What do we mean by social distancing? If you are in an enclosed area, like for example, I don't know whether you remember COVID-19 was first appeared in Washington State in a nursing home. So it's an enclosed space. Then we had to talk about the ventilation system. So this is where we get the differential equations. So the first one is the change in number of susceptibles in the community. And the second one is the change in number of infected. And the third one is the change in number of removed in the community. So normally what I do is I tell the students, they come up with the equations. So I tell them, okay, we are going to look at the change in the number of susceptibles. So that's the ds by dt. Then I say, okay, it's equal to what? So I ask the question, the number of susceptibles is going to decrease or increase, or it's going to stay the same. So they are going to say, oh, it's going to decrease because some of the people are going to get infected. So I say, yeah, put a minus there. It's going to decrease. Then it's going to decrease based on what? What is going to make them decrease? So number of infected people. So if there are more infected people, hopefully there will be more people get infected. So it's proportional to I. In a similar fashion, it should be proportional to S also. So you have the term minus beta Si, where beta is going to be the constant, and that will be the constant that will represent the transmission rate. In a similar fashion, we have the second equation, di by dt. That's for the rate of infection. So then the question is, how does the number of infected people change? The people who were infected in the susceptible compartment, they are going to move into the compartment in I. So that's going to be beta Si. Then are they going to stay there forever? The answer is no, because some of them are going to get better and they're going to move out of that compartment. So that's going to be your gamma I. And also in this case, like for example, if you are thinking about COVID-19, the gamma may include people who may have passed away or who may have been isolated. So gamma I is going to, look at the collective group of people who recover and who pass away or who get isolated. So then when you come to the third equation, dr by dt, that's going to be the number of people who are going to recover or got removed. So dr by dt is going to be gamma I. So these are the three differential equations they will see. So now they can see the meaning of these equations. Then the question is, when we try to solve this equation, what does that mean? So before I even do that, what I do is, I ask the question, right? Let us say there's a small community of 500 people. Then one weekend, a visitor came from out of town, and that person came with the infection. So now we have 500 people plus one infected person who came from out of town. So the question is, now what's the dynamics that's going to happen in that community? So they are going to say that the number of infected people is going to go up. So the question is, okay, it's going to go up. Is it going to go up forever? Or what's going to happen? So they will say, it will go up till all the people are infected. Then I ask the question, is that true? Whether everybody is going to be infected or not? Maybe not, right? So I will say, let us see from the model whether we can find it. So what I do is I look at the first two equations, ds by dt equal to minus beta si, and then di by dt equal to beta si minus gamma I. Now, if I divide the second equation by the first equation, I'm going to get a relationship between I and s. I get di by ds equal to, it's going to be minus 1 plus gamma over beta times 1 over s. So that will be a simple differential equation. And then all you can do is you can integrate that equation. So if you integrate that equation, you are going to get a nice description of I in terms of s. Now, if you draw that graph, that will show that disease is going to increase and it's going to peak at some point, then it's going to come down. Then I ask the question, when it comes down, what happens? It's going to come down so that it goes through 0. That means there are 0 infected and 0 susceptible. Or does it go through the y-axis where it's going to be 0 susceptible and some infected people? Or does it go through the horizontal axis where it's going to be no infected, but maybe some susceptibles? And when I ask the question, they don't know the answer. So then I ask them to play with that expression we obtained. And when they do that, they find out then when the infection dies, be some susceptibles. So there are some lucky people who never got infected. Okay, so that's kind of a little surprise for them. So this is one of the things I do in the class. Then you ask the question. Now, we have assumed here beta, the rate of transmission, and gamma is the rate of removal. They are all constants. Now, what is gamma? How do we come up with a number for gamma? How do you estimate a value for gamma? Because gamma is the rate of removal. So I say, okay, let us think about COVID-19. When somebody got infected with COVID-19 virus, what was the recommendation? Then they would say, okay, you have to isolate for 14 days. So if one person infected, after 14 days, that person is coming out as recovered, right? So that means your gamma is going to be 1/14. So they can relate that, what they see in real life to what they see in the differential equation and the parameters. Then when you talk about beta, the rate of transmission, again, we are taking that as a constant. But in real life, what will happen? If you're in a small community, you came to know that there are a lot of infected people, even without anybody telling you or mandating anything, you are going to be a little more careful. You're going to maintain a social distance. I mean, like, you would have seen during the time of COVID, even your friends may not come closer to you when you are talking to them. They may be far away. It's not because somebody told them, but because it's a human behavior. You are trying to be far away from the next person without knowing whether that person is infected or not. So you are doing a social distancing all by yourself. So that means that beta cannot be a constant. Beta should be something different. So how do we change that? So let me go. Okay, so this is a typical solution you get, if you're going to find the number of infected in terms of the time, number of days, you get a graph like like a pulse, like a graph. And, these graphs were created by one of my undergraduate students for different types of variants of the COVID virus. Now, if I go to the next slide. So if you look at the first bullet point there, so that is where, I am trying to play with the rate of transmission beta. So in the model I showed you before, you had the term beta times S times I. Now what I have is beta divided by 1 plus alpha I times S times I. So beta divided by 1 plus alpha I means that when the number of infected people increases, beta is going to decrease because you are dividing beta by 1 plus alpha I, where alpha is a positive constant. So this is where we are kind of making the assumption when there are more infected people in the community, the susceptible people are trying to be maintaining a social distancing all by themselves, trying to avoid getting infected. So their human behavior is reducing the interaction, and because of that, the transmission rate may reduce. So now the differential equation has become a little more complicated because your beta is not a constant. Beta is a function of the infected I. So normally we can work with this differential equation also. I mean, I did this only last week in the class. So here, we need to, in terms of a differential equation, it will turn into a Bernoulli type differential equation we need to solve. So that's one way of introducing them to the Bernoulli type differential equation through this model. The other thing we can do is we can talk about social distancing. That's the D beta function of D, social distancing as a function, it will be a function of the beta, the transmission rate. So where we can say, depending on the behavior, that the social distancing can change in time. So you have a fourth variable, D, which can change in time. So instead of 3 differential equations, now you're going to have 4 differential equations, where the fourth equation is going to be for the distance d. And the third bullet point is the transmission rate, where you talk about ventilation. That is, if you're in an enclosed area, then how the ventilation in the enclosed area can impact your transmission rate. So that's going to depend on the volume of the room you are in, the space you are in, and what kind of ventilation you got, and those kind of things can be there. So, for example, let us say when we had COVID-19, that was a new disease that came about, and we know that it started to spread. So the number of infected is started to go up. And the question is, when it's going to come down? So like I said early on, that we can come up with the expression for the number of infected in terms of the number of susceptibles, where we can show it will peak and then come down. So I asked a question in the class. Now, why do we need to study this? What's the point of studying this mathematical model? Just for the fun of it, or whether you have any realistic implications and we can have any decision made based on the model? Then they will start to think. Then I ask a question, okay, if people are infected, where do they go? They say they go to the hospital. So if they go to the hospital, now if they had to be hospitalized, how many beds do they need in the hospital? Right? If there are going to be 200 people, 300 people getting infected, they need to be hospitalized. Whether do we have enough beds in the hospital? The answer is no, right? So that's why we need to understand what's happening and how we can bring that peak a lot sooner. If we bring the peak a lot sooner, then the disease is going to die out. Okay, that's one of the way you can help the public health officials on what we are trying to do. And also in terms of ventilation rate, you can play with different ventilation rates in the model and then decide for a particular type of room or particular type of space with a certain volume, what kind of ventilation you need to install in order to have the spread decreased. So these are some of the things I do in the class. We are trying to connect a realistic problem with the differential equations to show them how the solutions they get and what kind of estimates they find for the infection rate are going to have real life implications, and they get excited about it. So I'm going to stop there, and then, if somebody wants to ask me any questions, I'm willing to answer.
Well, first of all, thank you very much. You've introduced some new notions that those of us who've done this model haven't thought before. And I really appreciate that.
Okay, thank you. Thank you for coming.
Right.
Yeah, bye.